Hello, my name is Jennifer Basio, and I will be discussing with you some of the methods of skill integration and application for effective communication. Forms of communication include verbal, nonverbal, and written behaviors. Within the nurse and patient relationship, information exchange between two individuals must be interpreted not only by the nurse, but also by the patient. A common method and skill that is integrated during nurse-patient communication is called therapeutic communication. We're all familiar with that term. Therapeutic communication is defined as a purposeful form of communication between the health professional and the patient that allows them to reach health-related goals through participation in a focused relationship. So it's mutual. Methods here used to integrate and apply this skill include active listening, restatement, reflection, asking appropriate questions, focused questions, encouraging elaboration, looking at alternatives, and lastly, the use of silence. Effective therapeutic communication between the nurse and patient begins with active listening. Listening actively means that the listener is communicating interest and attention to the patient. The goal of active listening here is to comprehend and understand fully what the other person is trying to communicate. The two important techniques for this active listening by the nurse is restatement and reflection. So you can use these two to practice this exercise. So restatement takes place when the nurse actively listens to what the patient has to say and then restates some or all of what the content was said back to the patient. When the content is restated, the patient has an opportunity to hear what he or she has said and therefore gains an understanding of how the nurse has perceived what he or she has communicated. Another technique or skill that you can use to increase your technique in active listening is reflection. So reflection is the process of identifying the main emotional theme in the conversation and directing it back to the patient. A little more difficult, right? But the nurse listens for what the underlying feeling that the patient is conveying and then shares this with the patient in a non-judgmental and open manner. This process allows the patient to explore his or her own ideas and gives the patient a clear understanding of the feeling they are expressing. The other form, questions, are also an important part of all phases of therapeutic communication because they allow the nurse to obtain information from the patient. The most effective method of asking questions is using the focused question method. Focused questions require a short response versus just a yes or no, which would be using closed-ended questions, right? These questions are more specific than open-ended questions, yet they allow the patient to elaborate on a certain subject. For example, a nurse asking a focused question might say, I see you have a lot of questions about your plan of care. What are the top 3 things that you are concerned about? By using this, you focus, yet you give the opportunity for the patient to express their concerns and avoiding the yes or no closed-ended question method. Other therapeutic communication methods that you can use to integrate therapeutic communication includes encouraging elaboration, looking at alternatives, and finally the use of silence. So encouraging elaboration is a technique that allows the patient to describe their concerns or problems under discussion in a more detailed manner. The nurse can look attentively at the patient and use short responses such as I see and go on to allow the patient to continue to explore their feelings. Looking at alternatives allows the nurse to help the patient increase the patient's perceived choices. It is important that before you use this method on a patient, you ensure that they have a clear understanding of the current situation. If you provide other alternatives for them, you will only confuse them if they're not completely clear of their situation. Lastly, one of the most effective but difficult techniques to use in therapeutic communication is the use of silence. So the use of silence is the period when no words are being spoken between the nurse and the patient, In therapeutic relationships, silent moments give the nurse and the patient time to observe each other, to digest what the messages have been communicated, and think of things to say. So, silence can be used deliberately and thoughtfully and can be a powerful listening tool. By applying all of the methods that we just discussed to integrate therapeutic communication, the nurse promotes a psychological setting that allows positive change, growth, and healing for the patient. And most of all, overall, you increase your effectiveness in communicating.